So the physiological role of GIP is primarily to stimulate the secretion of insulin from the pancreas. But beyond its physiological role, there are pharmacological roles of GIP when we make the drug long-acting. And when we give long-acting GIP, the long-acting GIP then acts in the brain to decrease body weight via inhibition of food intake. And this is mediated via the brain GIP receptor. When we give long-acting GIP into animals that lack the GIP receptor in the brain, the drug will lose its efficacy to decrease body weight. And these data, we have just seen data from Ruth Jimeno showing that this data also translate into humans. With the GLP-1 receptor agonists, we primarily activate only one receptor, which is the GLP-1 receptor, which also acts in the brain to decrease body weight via inhibition of food intake. But in addition to this, the dual agonists, which also have GIP on board, they have now an independent mechanism to also further decrease body weight via additional inhibition of food intake. And beyond this, GIP also acts in the adipose tissue, where GIP, depending on the insulin levels, can either stimulate the storage of lipids or it can stimulate the utilization of lipids by stimulating lipolysis. And all of this depends in the presence or absence of insulin. So in the presence of insulin, GIP accelerates the anti-lipolytic effect of insulin and stores triglycerides in the adipose tissue. But under low insulin levels, or when we are insulin resistant, GIP stimulates lipolysis and decreases fat mass. So in the last years, we could identify that GIP, and particularly long-acting GIP, acts in the brain via the brain GIP receptor to decrease body weight and food intake. And we also identified the neurons by which GIP acts in the brain to decrease body weight and food intake. And these are the neurons that express the GIP receptor on the GABAergic neurons. And very recently, we also have data showing that the GIP receptor agonists and the antagonists decrease body weight and food intake via different mechanisms. So in the future, we will of course further work on developing novel molecules that maybe not only activate 1 or 2 molecules, but maybe also activate 4, 5 or 6 molecules. And we will also work on specific drugs designed to favor specific obesity-linked comorbidities, for example, atherosclerosis or also fatty liver disease. I mean, naturally, of course, I'm always interested in new drug developments. Also, the oral GLP-1 receptor mimetics are pretty interesting. But of course, because I worked on the dual and triple agonists, I'm also very interested in seeing progress in how these novel dual and triple agonists perform in the clinic to treat obesity, diabetes, fatty liver disease, and so on. So this is really interesting for me.